So if I put my instrument on the distal of the third molar, you guys see that? Somebody's behind me. Ms. Vu, you can see this?
Yes.
Okay. I can see my second, and I can even see my first. So you want your mirror in so that you can rotate it. Mirrors should not be here, and you don't want to pinch the corner of your patient's mouth as well. Okay? Mirrors are meant to be retracted completely, okay, for the patient either this way or this way, and you need an actual fulcrum, okay? Shouldn't be like that. So be mindful of your patients. Now that you guys are working, some people are like, ooh, this hurts. And I love how y'all are so kind to tell each other. Did that help you?
Mm-hmm.
Okay. Any other questions about that? Okay, so we'll move forward with your stroke activation and adaptation. You want to read, Miss Burt? Or you, since you're right here? You're so kind. Thank you. Miss Burt is sweet. Come on, Miss Burt.
Maintain site of tip on tooth.
Okay, so with your periodontal probe, this is considered a tip. Even though it has a ball point, this actually can be tender to a patient. What I want to mention with your probe is that patient's tissues, as you guys have found, is when you guys are doing with your scalers, some patients bleed. If you guys have now covered it in class, you will be covering with the periodontal probe is that some patients will bleed upon probing, not necessarily by anything that you're doing. Maybe it's their home care. It could be related to medications and things like that. We're going to cover here in clinic in the next week or so gingival description. I'll be giving you information on that and assessing what the patient's appearance of the tissue looks like, so that when you see it, you can assess and say, oh, this is what all these different things look like on a patient. With the periodontal probing, when you actually use the instrument, some patients, as soon as you insert your probe, you may see bleeding. We call that bleeding on probing. So it may be titled, or you see an acronym, BOP. When you're talking to someone is assisting you with the probing, we record numbers. We are not there yet. Right now we're working on technique, which means we've got to teach you guys how to perform the technique. Then we're going to learn how to chart numbers. Okay? If someone is assisting you, you may say to them, BOP on tooth number 3 in this particular site. Okay? Each tooth has 6 sites. Okay, we're going to teach you how to record it later, but what we're doing today is the actual technique. So on the front side of the tooth, there are 3 numbers for each tooth. On the lingual, which means facial, we have 3 numbers. On the facial, we have 3 numbers on the lingual. Okay? For the technique, as she just mentioned, we need to maintain the side of the tip on the tooth. What that means is, let me open this back up. This tip here the side of my actual tip needs to be against the tooth at all times. So I need to think about how I'm going to position and think about the anatomy of the tooth. When you guys had anatomy back in the fall semester, how is that tooth shaped subgingival? Periodontal probe is going to be inserted into the epithelial attachment to the depth of where we're supposed to go. So some questions we got last semester is, how far am I supposed to be going? How do I know about a tooth, and how far does my instrument supposed to go for calculus removal? This is where you learn that. When we take readings with periodontal probing, you're going to learn how far to go for each patient. Okay? So maintaining the side of the tip against the tooth means that I can't be like this on the tooth because that's not adapted, right? I got to go with the curvature of the tooth subgingival. So I need to adapt it here. This is just an example, supragingival, so you can see, right? Everybody see that? So I had to angle in order to be adapted on this particular area. That makes sense? Mm-hmm. So you need to adapt it to where you can feel it. So if I go subgingival, I can't be here. See my instrument poking through that gingiva there? Mm-hmm. I need to rotate it here to adapt it against the actual root surface. Okay?
So places working end as close to parallel to the long axis of tooth, making adjustment for tooth contour.
Okay, so for an actual incisor there, or the incisor, this tooth here doesn't just go straight like this, right? An incisor actually goes in this way. So when we're thinking about probing, we're going to start here on the distal part and go distally and tilt. Our technique is to start in the distal line angle, just like we do in our instruments. Adapt it on the distal, insert, and we use what we call a walking stroke or a bobbing. And when I talked about you're able to use some digital technique, modified pen grasp, and a fulcrum, you're going to start, and there's a sequence as it talks about on your paper here under the general principles. You're going to use a systematic sequence. You must use this sequence, and because our computer system, which you record the numbers, I have to mention this, it's very important. When you're doing this, and I talked about where we'll be recording numbers, the sequence is, as it tells you here, from 1 to 16 facial. You must start with that tooth that's furthest back in that patient's mouth. If the patient's missing 1, you're going to start with tooth number 2. And you go forward. And the reason why you're starting with the furthest tooth, because you're recording numbers. If you try to start with number 8, all of your numbers are messed up. Everybody with me on that? Yeah. You're going to start in that distal line angle, just like you did with your actual instruments, and come around. When you reach this contact, which means where the two teeth touch, I'm going to tilt into my coal, okay? Stand it up and come back around, bobbing. Mesial, tilt. Come out. Probe is one of the easiest instruments you'll ever use. I'll show you in the next tooth. Adapt it against the tooth. Reach the contact. Tilt into the coal area. Stand it up. Come back around. Reach contact. Tilt. Notice what I didn't do was come around here and try to tilt this way, because I'm not adapted against the tooth, right? Mm-hmm. So when I come around, I have to tilt this way against the tooth, right? Make sure I'm adapted. If I try to do here, look where I'm at. I'm on nothing but air. So when I do this, into the coal. Everybody with me on that? Wait until you reach the contact, which means where these two teeth attach, before you tilt. If you see bleeding, where you see bleeding at is where you're actually going to document it. As I mentioned, there's a total of 3 areas where we actually will document bleeding or document numbers. And the numbers are, there's a total of 3 areas on the facial, okay? We're going to talk about that, but for now, we want you to focus on your technique. On your anterior, what this looks like, anterior, and you're going to keep going. Reach the contact. Okay. I'm at the midline here. I'm still going to keep going. See the difference where I'm still adapted against the tooth. All right, when it comes to reading a probe, one thing I want to mention is with a probe, it's read, this particular one, 1, 2, 3, 4 is when we reach this thick black line, 5, 6, 7, 8, 9, 10, which is the next thick black line, 11, 12, 13, 14 is the last thick black line, and 15 is the very end. What that means is when you're reading this, what is hidden is not the number that you're going to actually record. So here I would not try to record 3 because 3 is subgingival. That means that this pocket depth is not a 3. Okay? If it's between the two numbers, I'm going to the next number. If it's in between two numbers, I'm going to 4. Does that make sense? Okay? And the last thing I want to mention about this is that when we're actually doing periodontal charting, that a patient can have different levels of the junctional epithelium in more than one area. So in one particular area, they may measure a 3, they may measure a 5 in another area. Periodontal disease can happen in any area of the mouth. I got ahead of you. I'm sorry. I asked you to read and then I didn't let you read. What did I miss?
Cover the entire pole area by overlapping with appropriate angulation from buccal and lingual on the mesial and distal.
Okay.
Uses a 1 millimeter slow walking stroke. Walks around entire sulcus. Remains in sulcus during consecutive strokes. Overlap strokes upon reinsertion.
Stop 1 moment. So as she mentioned, you're doing both buccal. So this buccal and facial, those terms are interchangeable. This is your buccal and facial. Lingually, it's the same thing. So on the lingual, I'm going to use same technique. So lingual, I'm still starting from this distal and going around and coming forward. Okay? So it's going to be the same thing even if I was on the interior. And you would have to tilt. So you have to train the eye for the same thing like you've done before. What exactly am I seeing in the curvature of your actual tooth? I do want to demonstrate a mandible because they're smaller so you guys can see. Seating for your periodontal probe, especially for the interior, is really like the most comfortable position for you. Does anybody have their charting? Because I think she mentioned that, Dr. Barnes. Periodontal probing, mandibular teeth 17 through 27 is in the back. 28 through 32 is going to be in your front. So she does have outlined here specific seating for periodontal probing. So be mindful of that and follow your retraction and vision recommendations as indicated for the similar areas during instrumentation. So for the vision and retraction, it's going to be the same as you have been doing. You do have specific areas for seating for the mandibular teeth. It's the only area that is actually specified on that. So, like I said, for these particular areas here, follow the correct angulation for that. Seem pretty easy? Not really? So the most important thing is light technique here. You're not, as y'all hear me say jab, you will not jab. You don't have to force your probe. It's a very light technique. There may be deposits. You guys have already felt deposits with your patients, meaning student partners. You felt some, or you're like, oh, I feel some capsules of supra and or sub. So with that, with the periodontal probe, if you have deposits, go over the deposit into the pocket. This mannequin has a deposit here, so in particular, I am actually going to go over the deposit down off into the, go over the deposit down off into the pocket to assess that. Okay.
What if there's a lot of calculus or buildup that we spend go?
In most cases you can. Sometimes if you cannot, then some of that may have to be removed before you would have to even assess it. Okay, so there are special circumstances where it has to be removed and we leave it blank until we can actually assess that area. But in most cases, if it's a lot of supra, you avoid the supra and go down, like angle over it.
So, but the purpose of the probing is not just calculus, is to dictate the depth of the pocket.
So the purpose of the
Probing.
periodontal probing is to assess for periodontal disease.
Okay.
So you're assessing for periodontal disease. Periodontal probe can also be used to assess for the size of lesions, okay? Whether they're intraoral or extraoral as well. But for right now, we're actually showing you technique for checking for pocket depth. This is how we're going to be assessing a patient for the health of their tissue, whether they have healthy tissue, whether they have gingivitis, whether they have periodontal disease. And a patient may have either. Okay? So going forward, if you've already tested off on your instruments, you'll have the opportunity to practice right now on your typodonts, and then practice on your student partners. Well, we're about to end clinic, but at home practice on your typodonts, and then next week we'll get a chance to practice on student partners so you can see what it's like. We will guide you, so you